Way back in 1988, 89, 90, aesthetic dentistry was not there in India. The term of aesthetic and cosmetic was not in India. We used to get excited to do full mouth extraction and then do a denture. But in 1990 and 91, when we started the Academy of Aesthetic Dentistry with the sole idea that why not teach everyone on this aspect. Kumar Swami, Rajesh Shetty, Ramesh Shankar, V.S. Mohan, Uday Shetty, and there are a lot of people who combined together, and we said why not we start an academy called Indian Academy of Aesthetic Dentistry.
I knew the path was difficult. I knew that the normal path that one takes with any introduction is ridicule, acceptance, approval, applause.
We started, and the boost which was given to us was then the President of Dental Council of India, Dr. R.K. Bali. So Bali gave us a real boost that okay, just go ahead because you are not doing anything unethical.
When I look back, 1991, August 10th at Goa, when we lit the inaugural lamp and launched this academy, when you also look at the vision of our founder president, Dr. Sandesh Mayekar, and the motley group of friends that he had, which formed the first board of directors for IAACD. From then on until now, the rich legacy that this academy enjoys is solely because of the interest and the passion generated by the founding fathers into the practitioners all over this country. Not only in this country, we even managed to percolate beyond the borders into other Asian countries.
So friends, that was the birth of Indian Academy of Aesthetic and Cosmetic Dentistry. So friends, the whole concept of starting the academy is to give education to public, education to dentists, as there is no post graduation in general dentistry. There was no post graduation in high technology dentistry. Everybody was doing their own branches of dentistry. So aesthetic dentistry came out as a branch for general dentist. And if you go back and see the history of dentistry in India, you will find that the advancement of dentistry took place from 91. The technology came in. With the technology came, we were doing metal crowns to acrylic, to composite, to ceramic, but then subsequently we came down to all ceramic restorations. So technology came forward, and with the technology everybody wants to learn and everyone wants to do a good job. But the biggest winner in this was people at large, where they came down to dentists and said, do you do this? And who gave them the information is internet and Google, etc. So the combination of advancement in technology there and advancement in technology here in dentistry, this combination worked very fine for dentists in this country.
Whom did we touch on the way? We intended to make an impact onto the general practitioners. We did that. We also planned to instill a sense of interest into the learning dentist, the undergrad, the postgrad students, the academicians. We did that. We didn't stop there. We also wanted to ensure that there's a level of standardization of work, of skills. So we introduced what's called as the accreditation process in the academy through the kind courtesy of Dr. Ramesh Shankar, past president of IAACD. And today, we are proud to say that we have so many accredited members, and people are actually aspiring to apply and to qualify as an accredited member of IAACD.
IACD has built on the foundation laid in 1991. And today, we are nearly 800 members of our academy spread all over the India. And not only in India, but we are also gone internationally.
What has all this given us? It has given us a sense of confidence, to give that sense of confidence to the patient, because they come to us seeking improvement in their appearance. So if we would bracket this aesthetic and cosmetic dentistry as appearance related dentistry, then all the procedures, all the techniques, all the technology involved has been propagated, has been also shared very graciously by all of us with people who are ready to learn. And at the end of the day, I am sure that this has helped to make India and Indians smile brighter, wider.
It's not only the annual conference which we have every year. We also have series of programs aimed for the general practitioners throughout the year all over India. For example, Iaacd at campus. We want to share with them the latest advances which are happening in aesthetic dentistry. For this, we go out to all the colleges as much as possible, covering as many students to share with them what is new. Not only the program ends here, we also have a competition among students on aesthetic dentistry. We all want to excel in our profession. But how do we know that we are doing a good job? Iaacd accreditation process is a step in that direction. After you have completed 13 months of your membership and attended minimum 2 conferences of Iaacd, you become eligible to appear for the examination process of accreditation of Iaacd. It's a process in which you appear for an examination. Part 1, which basically consists of a MCQ question paper you answer as well as your clinical cases you submit. When you clear this part 1, you become eligible for part 2. The part 2 exam consists of a bench test, which is to reproduce a procedure on a mounted teeth as well as a viva voce. Once you clear this exam, you join an allied group of dentists called Iaacd accredited member. You can apply for the membership of Iaacd by downloading the form and send it to the secretariat, or you can fill it up even online.
Iaacd administration handles all your queries very promptly. You can email us or send SMS, we will get back to you. You can follow us on Facebook page or join Iaacd group by sending a request. You can showcase your clinical cases and get guidance from our senior members.
Since our members are spread all over India, it's not possible for them to come for each and every function of Iaacd. So this year we started a Iaacd Studies Circle. This is a unique project in which the members of a particular city come together and form a group. This group meets regularly and deliberate on a topic of aesthetic dentistry. Whenever possible, we also try to send the faculty for helping them in order to make this a scientific and clinical oriented discussion. We all learn continuously, and in order to make the learning a very productive, interesting and exhilarating experience which is based on scientific content and clinical excellence, we have an Iaacd journal called Aesthetic Expression. Dr. V.S. Mohan is the editor in charge of this journal. You can also contribute to this journal by sending your articles or your clinical cases to the editor.
Today in 2016 we are celebrating silver jubilee of our academy, and we have got a great speakers who are renowned speakers who always stood by our academy. One was Dr. George Friedman from Canada. He has come and given us the latest technology to us. So he is coming this year also. So we have this 25th conference between 12th, 13th, 14th of August in Mumbai. The reason we are having in Mumbai because is that we can have a different show. It has a bigger convention hall. The connectivity to Mumbai is too good. So we decided to keep the charges very low, and if you see the brochure, the charges is only 2,500. But if you want to attend the courses, there are little charges, but the main charge for everybody is 2,500. If you listen to the second speaker, none other than Galib Ghurel. Today, he is the most sought after speaker in the whole world. His book is a bestseller till today on ceramic laminate veneers. He is not only given lecture for 2 hours, but he is conducting a course, hands-on demonstration, and you people also can do it. So imagine what you have in this conference. And then we have got people coming from Lima, Peru, from Germany, from USA on different aspects of aesthetic dentistry. Another important aspect of this conference is we have got 4 symposias where we have included speakers for nationally well known. Besides our academy speakers, starting from myself to Kumar to Ajit to Sushant Umbre, Kanir Bhatia, Pankaj Maheshwari, Prashant Hatkar, you can see the whole lot of name in that. We also included Sunil Bulabhai as well as Deepak Muchala. The symposia, 4 symposia, first is smile design. So you should know what is smile design. There is a wave of so called digital smile design. So in this we are going to show you, is that necessary? What are the advantage? What are the disadvantage? What can be done? So we have got digital, mock-up. So all these different aspects will be done in smile design. Then we have got functional smile design, that you are doing smile, but the restoration should stay long and patient should not have any problem. So on the posterior aspects, so functional smile design, we have got occlusion etc. to be considered, introducing of T-scan and other things will be there. Then we have got symposia smile beyond pink and white. Friends, we are doing smile on pink and white. We see we do teeth and we change the smile. You do not change the smile. We enhance the smile. So what is more necessary is beyond pink and white. So we have got plastic surgeon, makeup artist. We have got a person who can teach you about Botox and fillers and all. And let me tell you, that is the future for dentist also. And then the most important aspect, we have learned everything, but how to manage the patient. How to convince the patient, how to tell patient that to convert the patient from treatment plan to treatment. So we got a symposia on marketing aesthetic dentistry. We can market aesthetic dentistry. Why? Because it's not needed. But we can tell that if your smile is not good, we can do the smile. Is something which patients want, is not needed. So we can market that. How to market that? And if you see the brochure, Karan Johar has given a nice statement. He has mentioned how aesthetic and cosmetic dentistry has changed the glamour industry. Even that was been endorsed by Jacqueline Fernandez. So all these people who need aesthetic and cosmetic dentistry. So all this combination, as a dentist, you have got variety of things to do, and this variety of things with the basic knowledge you can learn only in aesthetic and cosmetic dentistry conference. We also have table clinics. In the trade area, they are going to show latest technology how to do that. You can do presentation on posters, you can do scientific presentation. So we have got exposure for young dentists, for older dentists to polish their knowledge, and the teachers to train us, train the young dentists. So Indian Academy of Aesthetic and Cosmetic Dentistry, friends, is the package for today's dentistry, that we are taking efforts for your benefit. And the last thing I would like to tell you, friends, I have got only limited attendance. We will have to stop in the moment my hall is full. So friends, register as early as possible and take the advantage of these stalwart speakers coming from different parts of the world, including national speakers, at just the nominal rate. Take home value is to upgrade your practice, multiply your practice by making patients happy. Learn and earn is far better than just earning without learning, and that's what the concept of our academy is, beyond billion smiles, because we want all the people to smile in this country by doing small jobs, big jobs, middle job in aesthetic and cosmetic dentistry.
Be a part of family of aesthetic dentists who just wants to excel. Be a member of IACD.
Join IACD to enhance your skills.
So 25 years from the day that we inaugurated, we are having a Silver Jubilee Conference at Nehru Center come August 12th to the 14th, where you will really see a completely new avatar of IACD with newer lectures, topics, newer speakers, newer hands-on courses. So you go back that much more confident to tackle the difficult smile.
So I hope to see you on 12th, 13th, 14th of August 2016
at Nehru Center, Mumbai, for the Silver Jubilee Conference of Indian Academy of Aesthetic and Cosmetic Dentistry.